Representative Pafford.
Thank you, Mr. Chair. So as an example, just to make sure I understand this, if I were to need one of these pain-killing drugs for a legitimate purpose, and Representative Renoir were my physician, would he be prohibited from giving me those pills directly? I would have to go to a pharmacy.
Yes, and I will try not to pretend that I'm a doctor in this scenario, but I can use myself. How would I use myself as an example? You know, I can remember years ago I had a very painful experience, which I like to call a kidney stone, which certainly anybody that's had those knows how painful they are. I went to the doctor, diagnosed a problem. They wrote me a script for a couple medicines, one of which was a pain medication. Miraculously, I was able to get to a pharmacy to have that filled, and went home and went on with curing that problem. Did not need the doctor right then and there to dispense that pain medication.
Follow up, Mr. Chair. Follow up. Go ahead.
Thank you, Mr. Chair. Last year, I believe Representative Skidmore had a kidney stone. Went to our clinic. I want to say, but I'm unsure, that she was able to get medication immediately before she went to the hospital. That wouldn't be permitted?
No. Again, Mr. Chair, thank you. That's direct administering, and yes, that would still, it would be the same as, and certainly one of the doctors can describe it further. It would be the same as you go in, you can get an inoculation, you can get that's direct administering. So yes, you can still do that.
I really appreciate the opportunity here. I do believe this is a potential tool, but I don't believe it's a silver bullet that will resolve this problem. Thank you very much.
Thank you, Mr. Shipley. I believe there's one question. Representative Pafford has a question.
Thank you, Mr. Chair. I know hospices around the state have certain responsibilities towards patients that are dying, maybe a few days left. How does this bill carve out a hospice that has a physician on staff, they're prescribing some serious meds to ease the pain of somebody who's dying, perhaps in hours? Does this bill clearly delineate those circumstances, or does this bill perhaps make the hospices around the state rethink how they're providing that end-stage care?
Mr. Chair?
You're recognized.
Sir, my reading of it is that if they're dispensing in that hospice, and that's the dispensing portion, then they would not be able to do that. However, if it's and doing my suggestion, what Dr. Renoir talked about, Representative Renoir, putting in the administration of medicines as an exception, which I believe everybody would agree with is probably right to do, would then not have a problem with the hospice, because certainly what you've talked about, my father-in-law just went through that, and I really have personal understanding of that.
You're recognized.
Thank you, Mr. Chair. And I think this questioning has been great. Representative Shank, you've done a great job. I had a list prepared this morning of things I'd mentioned, specifically about why I wouldn't support this PCB. And then it came to me actually during the questioning period that really this comes down for me to one simple issue, and that is, it's fascinating, as much as perhaps we don't agree as members on a lot of things, if I go down with a heart attack or break my leg today, which could happen, you've seen me walk around this place, I could fall down, I really would prefer that somebody, a colleague that I respect, who happens to be sitting on this committee, would be able to provide me assistance immediately. And that's just one small story. There's 19 million people in this state. Everybody's got a different story. I think basically that the language goes way too far, and we ought to spend more time making sure that the current law is enacted and funded so we can keep the database and move forward. So I again, respectfully, I'm not going to support this, but I do appreciate this process. I think it's been great for everybody. Thank you, Mr. Chair.
Thank you, Representative Shank. Representative Kriegel. In debate.
Thank you very much, Mr. Vice Chair. It has been pointed out pretty well by several people here that, especially the Colonel Grant who spoke last, that this does represent an intrusion into the medical practice here. But with there being 7 deaths per day, I think as a legislative body, we need to do something to try and make a dent here. This bill is far from perfect, and it needs a lot of work, but I think it is a start. What this bill does is going to take some of the profit out of the business model of some of these pain clinics where they make money on dispensing the pills. It will definitely go at the head of the snake, but it won't chop it off completely. They are simply going to change their business model to that of writing prescriptions and having the pharmacy do it. And we're left in a quandary here. Unfortunately, it's kind of like stopping hijacking, where the TSA gets very intrusive in their efforts to prevent a repeat of 9/11. If we're going to really make a dent in these pill mills and not just change their business practice to a slightly different model, we're going to end up in one form or another being intrusive into doctors' practices and intrusive into the relationship between the physician and the patient. Representative Harrell brought up a very good point, and that is that there are medications which are not narcotics, which come under Schedule 2 through 5, and she brought up the point that perhaps we should itemize these medications, and I think it's a very good point. Chairman Schenck brought up the idea that doing it broadly is keeps it from, for example, anything Schedule 1 through 5. Doing a broad stroke like that keeps new drugs which would come on the street under it, but I need to point out that nothing's scheduled until a legislative body, this one or some other one, places a new drug into a schedule. So I think that needs to be taken a look at there. Finally, the last item is that of we need to preserve the ability of any physician to directly administer medication, injectable or oral, to a patient in the office practice setting. And if we don't, we're going to put all dentists and half the doctors out of business. There is an amendment to that effect. However, I'm not going to file this amendment because Krista worked very late into the night getting it up, but if you read it directly, it says that the only exception would be for medications administered to a practicing physician. And although I've wanted to do that a few times, I haven't done so. At the end of the day, this bill needs a lot of work, but it's a good start, and I'm going to vote for it. Thank you.
Thank you, Representative Kriegel.
Thank you, Mr. Chair. Oh, I'm sorry, yeah. Everything's new today. Thank you, Mr. Chair. In debate, I am going to use part of my list, actually. A number of issues with repealing. I think it's wonderful that people have showed up today to talk about what the repeal would do in terms of impacting people, and that's what it comes down to for me. But again, and I wanted to go there during the first portion of the meeting. What we're going to do is remove a bipartisan legislative effort that started 2002 that, and you know, if anybody knows this process, it takes years to produce something people can agree to. That's the first problem I have with this. It's a complete change of philosophy, and oddly enough, what we're going to do is repeal language and insert a bill, most likely that we just heard, which is frankly half-baked, didn't even consider hospice. There's so many problems with that bill. We're kind of setting this up. We're aligning ourselves for this to occur. One of the good portions about this current legislation, there was no government financing, which seems to be this cornerstone of anything we do here. I've got tons of letters in my office. I'm happy to show those to you. Police, the state's attorneys throughout the state like this current language. In fact, we have an attorney general and a Senate president who seem to like the database. As I said, one of the things that comes down to the bottom line for me is, I'm from Miami. I've lost friends who've died from overdoses, from abuse of prescription medicine. I can tell you firsthand that these problems don't occur with the way that's been described during our first portion of the meeting. It is family and it is friends. Those folks need to be controlled. The database will provide the information to ensure that those medicines are properly distributed. That really is it. The woman that I am speaking about, who I'm not going to obviously mention by name, she'll be dead this year because she will continue to go back to her family and her friends. They will continue to provide those medications. She will die. She's already been in the hospital, yet we're talking about removing something that is going to set us back. And so, again, I'm probably not going to get mouth-to-mouth again. But I do appreciate this opportunity to at least explain what one member's point of view is. Mr. Chair, thank you. And Representative Schenck, another good job. Thank you.